Hey there, guys. Between two teeth, we usually don't talk about teeth, but today you're in for a special treat. We're talking about teeth, we're talking about oral maxillofacial surgery and periodontics with our good friend from the podcast Everyday Oral Surgery, Dr. Grant Stuckey. Please give a listen.
Very well said. I think that's you hit it on the head. And it's just that it's hard to step across the aisle, especially if you come from more years of education. I mean, if I can put myself into it, I can have sympathy for it. You gave a lot of your time. The hours are forever more intense, and the cases there's more on those cases. And what Bob and I had talked about initially, as far as just our differences and similarities in training, something a periodontist does is the alveolar ridges, and we get a big magnifying glass and we zoom in on the alveolar ridges for 3 years. Bone grafting, soft tissue, suturing, all different types of tools and instrumentation, everything to get that extra millimeter. And sometimes an extra millimeter matters, and sometimes to Bob's point that he makes sometimes, hey, the body's going to heal, and it's more important just for the body to heal than to get an extra millimeter. And so it's really, Grant, exactly what you're saying, knowing how to get that chip off your shoulder and knowing when to cross the aisle. And then also, one of common I've heard from an oral surgery buddy is that, hey, I tried to work with a periodontist, and one, I wasn't impressed, and two, they kind of blew me off, so I'm not going to do that anymore. There are, like any profession, there's a spectrum of personalities on both sides. And hey, if it didn't work out with one periodontist or one oral surgeon, try not to have that taint your view for the entire profession. The next one you meet might be completely different, and so just kind of holding up the greater good and trying to maybe bypass that first tricky personality that you interacted with could help.
Here's what I would say. If you're in a coffee shop and you turn around to the person behind you, they can do many things, a lot better than you can do them. And, if you are closed-minded and if you think that, you can't learn something from someone else, you're not going to grow and someone's going to pass you by.
Sure. Totally agree. Got to drop it and learn from each other for sure.
And as I said, I'm really encouraged what our specialty is doing. I love our specialty. I think our training is great. There's many things we can do, but there's also so many things that we can participate and be leaders with others, on patient safety issues regarding anesthesia, on things like well-being. Right now, provider wellness is a huge issue. Steph, I know you're a wellness ambassador with the American Dental Association, and we had a chance to have, what was the meeting they just had last year?
It was the Well-Being Summit.
The Well-Being Summit. Amos was the only specialty that was represented there. And I had reached out to Dr. Paul Schwartz and said, hey, this is happening. He goes, I am passionate about this. This is something we're starting a provider program through Amos for substance use disorders, and we want to be there. And he was there. Karen, the executive director of Amos, was there, and Deb Sackow, trustee with Amos, was there as well. And they were in the front row. So some things are happening, and one of the things I like to do, I like to push. Unfortunately, sometimes that causes problems. But like with working in this kind of model, we've been pushing it, and we're speaking at Amos, and people are picking up some of that messaging.
Yes, and question for Grant and Bobby here. And Grant, you had mentioned you had to shed whatever layer and just say, hey, I am going to reach across the aisle. I'm curious. There was something about procedure or something you saw from a periodontist that you were like, yeah, maybe there's something different. And so between you and Bobby, what's your why? Why did you even, how did you make that leap, that jump?
Well, so for me, it was in placing implants in the aesthetic zone. And I'm a surgeon who, like, I got a lot of great training in implants. I placed, over 150, 200 implants. For an oral surgeon, that's a lot in residency. And so I felt pretty good, I thought I knew what I was doing. And then I got out and I had some, bad cases with some aesthetic zone cases that didn't work out like I wanted it to. And some of the offices would kind of start saying, let's go to this periodontist instead of Dr. Stuckey because he had these couple bad cases. And then inevitably our offices always screw up the schedule. And so I'll like see his follow-ups on my schedule and they'll like come to me for the uncovery. It's like, what insulting thing, slap your face. The periodontist puts the implant and you do the uncover. It's like, talk about humiliating. But I'm the kind of person who's like, if they're in my chair, I'm going to help them out. I'm not going to be like, hey, I didn't do this implant. And so I would text this guy, hey, it's looking good. Here's some pictures. What do you think? Are you cool with me uncovering this implant or doing whatever it needs to be done? And he's a pretty chill guy. And I was like, oh, for sure. Thanks for doing that. And so I started talking to him. Hey, I really like what I'm seeing here on some of your follow-ups. It looks good. I'm taking these CBCTs. The healing looks great. What are you doing? Can you give me some insider information? And so for me, it was just the desire to do better and help my patients and have better results. And I was able, to kind of get over any pride. It probably helped that this periodontist, had been out of practice much longer than I had and was much more experienced at implants. And so it was easier for me just to drop all pretenses and say, hey man, what's going on? I need some help. And so that was great. I think to me, it's like kind of analogous to like, how the neurosurgeon and an orthopedic surgeon, they both work on the spine, but then they both work on a bunch of other stuff that's not related. And so, because I had a back surgery and I was like kind of going back and forth, who's better? And they all pitched their things about, oh, the neurosurgeon's going to be more careful with the nerves and they're not going to screw things up. They're more delicate. And the orthopedics, well, the orthopedics just going to get her done, like that's what we do. We take out some big chisels and we start whacking, it's like, that's analogous to the oral surgeon and the periodontist. I don't know. What are your guys' thoughts on that?
I had a neurosurgeon and an orthopedic surgeon in my MBA class, and they had constant banter back and forth. But I like what you talked about there. Just our preconceptions or preconceived ideas. If you don't want to learn and get better, then don't listen to a single thing we've said. Just turn off the podcast right now. And Grant's going to edit that out. It's like, I cannot believe they just said. But seriously,
do not do that.
Yeah. Well, yeah. Grant, I appreciate the vulnerability on your story. I've had, I can relate being in the phase of my career where I am new in practice. I can relate to that in a big way.
You came out and you were highly confident.
And it's just, we need providers, quite frankly, like you, Grant, that are putting the patient first. And not only that is after you asked, for just like, hey, what do you think on this? Think of how many residents have benefited from your branching out. And now when they get out, they're going to be the person that someone might ask and say, hey, how do I do this?
Seek first to understand and be okay asking. Yeah. Can I ask you a question?
You didn't answer my first one.
that's how I roll. What's your question?
Well, my question to you and Grant had a great answer, was that, why did you even, what was your why? Why did you reach across the aisle?
Because I wanted to get better, and we had the concept of a multi-specialty center, and we needed a periodontist to complete that model. And then just me personally, I felt good about myself and thought, okay, yeah, I need to learn. I'm better if I learn. And you helped me on a long learning journey. Now, my question to you is, what did you learn by working with an OMS?
A ton.
Oh, good. That's it.
Max benefit on my perspective. It helped me appreciate in a big way what you guys go through and gals go through. It's a phenomenal. You know, my program director talked about, you know, respect and ego in our residency, and he goes, some of the people that definitely have earned the right to have an ego are our oral maxillofacial surgeons because of what they go through to benefit dentistry as a whole. And so, yeah, I've learned so much from Bob just in a emergency management of the patient, the medicine. Man, it's what I am constantly trying to catch up on in our practice as we see some of the sickest patients in our area. I have to, you know, scramble to catch up on the medicine, and that's something that, you know, Bob's helped with a lot. And from a IV sedation perspective and a patient safety perspective, emergency management, and then just, you know, technique and working with other providers. One of the cool things that I think oral surgeons bring to the table is how they interact with the community and their position in a referral group. And so I've been able to benefit off of that, off of those relationships. And I've been able to benefit with how patients just kind of, you know, look and learn from you, and how our providers look and learn to you.
Like that. Like that a lot. You know, something I've seen, which is kind of unfortunate, is when you're in this group setting, oftentimes I see the oral surgeon almost throwing up their hands and in regards to implants and saying, you know what, that's fine. The periodontist can just do implants, and I'll stick to wisdom teeth. And I mean, wisdom teeth are easier, and implants, they're just more follow up and more problems can happen. So, yeah, screw trying to learn more about implants or do more or anything like that. Just take them, and that type of a thing. I've seen that happen with some friends of mine, and I refuse to do that because I had great training in implants. I love doing it, and so for me, it's the opposite direction. But I would hate for that competition there just to make one or the other kind of shrink and the other grow. I'd like to see both grow together and learn. Do you know what I'm saying?
Oh, absolutely. There's no reason that as a provider you can't, you know, if you want to just do wisdom teeth, that's great. But absolutely, to your point, Grant, if you are someone who is like, no, I had great training in implants, I'm not gonna step aside here because I find the joy in that. That's part of my profession. That's
And
part of what I want to do.
I like what Grant said there. Grow together. If you
Yeah.
don't want to grow together, turn off this podcast. Grant will
Grant's
never.
like,
to
no,
go.
wait a
Grant
minute.
will never invite us back ever again.
We're gonna edit that
pushing
one
him. We
out
keep pushing
too.
him. No, but it's true. You know, just
It-
if you can grow, you can learn. You got to put your ego where it needs to be.
Educate your referrals. You need referrals with a more flexible mindset. Some referrals have interacted with a oral surgeon that they really like, and they have no room for a periodontist. And some referrals, it's the exact opposite. And one of the things that Bobby and I had to do with our referrals is really get them into a flexible mindset of, look, you're referring to our practice, and we're going to put the patient above everything else. And together, we are going to care for this patient. And that has worked tremendously. And it just comes back to communication.
Yeah, and it gets back to Grant's point. If it is a DSO, there needs to be leadership that says this is important to us. And as a regulator, I've seen DSOs evolve, and things from 10 years ago, they're different now, and patient satisfaction, risk mitigation, financially, it's a disincentive to have work that needs to be redone.
And if you're a resident looking at a DSO model, it's kind of like asking about residency programs with a program director. When you're interviewing, say, hey, how are patients divvied up?
Yeah.
And how do you guys treat the different specialties?
So let's do, to get to Grant's point of, if you're a periodontist that's in a DSO, you're a new grad, what would you say to an OMS to say, can I come in and watch you do a case?
So The scenario is I'm a new grad.
You're a new grad. You
And-
just started with this DSO. I'm an oral surgeon. I've been out in practice for 20 years.
Right.
I'm a little bit cranky.
So I'd want
What are you
to
gonna say to
before
me?
signing on the dotted
Yes.
line. That's a scenario that a periodontist wants to be careful on. If you have an established oral surgeon at this DSO office, you want to. It depends on what procedures you want to do as a periodontist, but you need to ask questions about okay. How am I going to be treated as far as how do I get patients?
So let's get to the question though about how you're going to interact with me. I'm grumpy old.
Well, that's my point, is that relationships, the foundation has to be there. And if you walk into a situation thinking you're going to place a lot of implants, I've had some corporate offices when I was looking for places to work, 5 years ago, I was like, hey, I'm a periodontist. I'm looking for a job. And they're like, we don't have any use for a periodontist in this corporation. We just hire oral surgeons and that's it. And I'm like, oh, okay. So that kind of got me thinking like the foundation's important. You got to figure out what's going on. But say you're in there. First thing, have coffee with the oral surgeon.
Don't come in hot.
That oral surgeon has got to be your best friend. And
Now, is that true?
it really is, because it's the person who is going to be doing the most similar things to you at the office. And what I found is siblings who are similar or friends who are very similar perhaps might fight a little bit more. And especially if you're new in practice, you want to have a foundation, a relationship with this person versus leaving it to chance, which if you leave it to chance, the chances of it going south are high.
Okay, I'm going to answer my own question then, because
You don't like my
Well,
answer?
I get what you're talking about. I was trying to get where the rubber meets the road. So we're going to change the scenario.
Yeah.
You're a periodontist. You've been in practice for 20 years. You've got experience. I'm a new grad. I'm an OMS. I'm going to look at it and say, how can I build goodwill with this person? And I may say, hey, would it be
That's
okay?
exactly what I
Yeah,
was saying.
well,
and
but-
now we introduce communication.
Yeah, exactly. But I'm going to say,
Yes.
would it be okay if I came in and just kind of watched you do X procedure?
Right, specifically
Or I'd really like to kind of learn and see, just kind of what Grant said. You've got good outcomes. I'd love to kind of learn some of the things that you're doing.
Your specific question was not that you create a relationship with the other provider. Your specific question is, how do you do that?
Yeah, how do you do it?
So this is an excellent example of how two different people Bob's asking this question, I'm answering it going, how could you not glean from this? And Bob's like, I'm going to ask it again because you didn't answer it. This is why you need to have a working relationship.
And I don't listen well.
Yeah.
I'm working on
Hey.
it. I hate to listen.
I get that.
But I
And if
realize...
I didn't, and this is the other thing, if I didn't know Bob, I would be so offended by that. But I know him, and I'm
Yes.
like, okay,
Yeah.
I'm gonna let these go. I'm gonna let it go because maybe I'm not clear.
Well-
how about that?
So you're not. And one of the things we're talking about at Amos is actually being clear.
Poor Grant this morning. He's just like,
Exactly.
Dear
He's-
diary, I'm gonna let these guys talk.
I'm loving it.
No,
And
so,
then at some
so-
point, I'm gonna cut him off.
So here's the deal. One of the things I've learned, if you want to be effective, you are well served to be clear and kind.
Brene Brown.
Yeah.
Brene Brown. That was something we learned at Brene Brown.
I like that.
Clear and kind. We think we're clear. Most of the time, we're not clear. And being kind, we meant to be kind, but how many times have we not been kind if we're talking to our assistants or talking to a colleague? You are effective if you're clear and kind. You can give hard, clear information in a kind way, but that takes nuance and it takes practice. What are you going to say?
Well, I want Grant to feel like he can definitely ask questions and
Well, it's his
say whatever he
podcast,
wants to say.
I keep telling
Because I'll
people
talk
to
forever. But
turn it
I
off.
want to make sure
We will
we're being
both talk
respectful.
forever. But yeah, Grant, what are you thinking as we...
Well, I love this topic and this point you're talking about, especially like that initial conversation that can happen there between how do I get in the door or how do I let someone in the door? Because I think first off, like when I just hear Bob putting this scenario out there, the old cranky surgeon and the young periodontist saying, can I come in? I think the old cranky guy is, very often going to think, well, I don't want this young
Yeah.
periodontist coming in and stealing my secrets and learning stuff. And,
Yeah.
no, let's keep our distance here. And I've learned one good way to get in the door is to be very specific with your why, and also, like Bob's saying, throw in the compliment and the kindness. So usually I'll be like, hey, Dr. Guayo, like I just keep seeing good cases from you, and I hear from other people who've worked with you that you suture really well. Like, do you mind if I stop by? Because I really want to up my suture game and just see kind of your suturing technique. And all of a sudden he's like, very not flattered, but like, oh wow, that's pretty cool. This guy has a specific need. He wants to learn a little better. Come on in. Like, it'd be rare for him to be like, no, I don't want you to learn my suturing technique. That's a secret.
And start small.
Well, you'd be surprised. Sometimes people will be like that. And okay, so you just hit it on the head, Grant. It's about the foundation. There is so much upside and there's so much potential here with perio and oral surgery working together, but the foundation has to be right. And, Bob, when you ask the question, how do you do this? What do you look for? If you don't have two willing participants, it's not going to happen.
And if you don't want to grow, it's really hard to be willing. And, this is where it takes leadership. It takes leadership perhaps from above, or it takes you as a practitioner, if you're an independent contractor, to step up as a leader and say, if we want to do our best, we are going to be served to learn from one another.
And if you talk about motivators, even from a business owner perspective, financial motivation, our practice would not have grown if we could not work together. If we didn't, do the groundwork with the referrals, if we didn't do the groundwork, just kind of figuring out how we were going to do things, it would have imploded, quite frankly.
Yep. It takes understanding, it takes patience, and it takes communication that is clear and kind. And sometimes I'm very unclear and not kind.